in Swift House, one of our buildings. We started off as a youth shelter and a youth sort of reconnection society many years ago, back in 1968. And we started to try and provide services that were cool at the time. It was the late 60s. For folks that were traveling the country or just living on the streets. We started to get more and more involved with folks that were more marginalized, more homeless, more mentally ill. The deinstitutionalization of mental health in the 80s really sort of contributed to that. This building was our first purpose-built building. We now have 20 buildings in 3 municipalities in the Greater Victoria area, but this was the first purpose-built one. As we would work in the shelters and set folks up with an apartment and an income and some connections and supports so that they would feel like they had a home, sometimes that would fall apart. Either they wouldn't be followed, or their mental health would deteriorate, or they'd get evicted and they'd wind up back in the shelters, and we'd find ourselves doing it all over again, which prompted us to think maybe we could do things a little better. So it was our first supported housing building. So it's subsidized in that people can afford it on the shelter allowance, and it's supported in that there's well-meaning staff there to work with the folks, to get to know them, to build relationships, to maybe be there when they decompensate or just need a little help or not. And so that has grown. We now have a different purpose-built shelter, Rock Bay Landing. We have a specific women's shelter, Sandy Merriman House, and we have a number of supported housing programs, plus a health clinic, a dental office, and numerous other support and employment services.
Hi, my name is Mary Chudley. I'm the Director of Health here at VicCoolAid Community Health Centre. Community health centres at their root are about serving populations who are marginalized, and that might be because of poverty, it might be because of specific issues that are going on in folks' lives, it might be because of where they live. So the fact that someone doesn't have primary health care close to home is a barrier to accessing. Another barrier to healthcare might be depending on the cultural identity of a population. There's so many different ways that healthcare actually in the service it wants to provide ends up being a barrier to people. One of the pillars of community health centers is that it is an interdisciplinary team of providers. So it's not physician as the boss and the other allied health professionals as the employees of the physician. We are all one team. And that is so important when you talk about giving care to someone, because what it means is that everyone does their job and uses their skill set to the extent that we need them to. A physician will do what a physician does best. A nurse will do what a nurse does best. Our doctors are doctors who work primarily here at VicCoolAid, but they're also on consult with the hospital for addictions medicine. They work at other clinics in the inner city, which really contributes to the collaboration, the connectedness, and the partnerships that we can foster in order to serve our population more. And then in addition to that, again, this interdisciplinary team, on staff here at VicCoolAid, we have a dietitian, we have counseling, we have outreach workers that are not only literally working in the community as outreach services to assist our medical staff, but they're also accompanying people who cannot otherwise get to those appointments that are outside of VicCoolAid. So specialist appointments at the hospital where they have to have further testing for a specific issue. We're able to provide transportation, accompaniment, another person to be alongside them in what often is the really challenging times.
Hi, I'm Peter. I'm a staff in the Overdose Prevention Unit at Rock Bay Landing. Our OPU has been open for about 3 years now. It was, I think, 3 years in February. And basically the service has been offered because during the overdose crisis that's been happening since about 2015, 2016, Rock Bay Landing has had a lot of issues with challenges around people overdosing in the building and out on the street. And so we created this secure location where people could come in and safely use. So our main motivations over the last 3 years have been primarily to keep people alive, educate about safe use, and continue to help people hopefully be healthier and safer in their use by creating spaces where they can get education, where they can get safe gear, where they can get clean gear, they can be educated about what they're doing with it. And so that's kind of been the main mission of our overdose prevention unit.
Sandy Merriman House is an emergency shelter for homeless or underhoused at-risk women. And when I say women, we use an inclusive definition of women and female. We welcome trans and non-binary people. Our shelter's open 365 days a year, 24 hours a day. We have 2 to 3 support workers and a client service worker. Sandy Merriman House is named after one of the women involved in the project. Here's actually a picture of Sandy Merriman working on the shelter. Sandy died in 1995 from an accidental overdose. In honor of her memory, the space now bears her name. Sandy Merriman House has been in operation since December 1995. Before the opening of Sandy Merriman House, there were no services in Victoria specifically targeting homeless or inadequately housed women. Men comprised the overwhelming majority of emergency shelter users, and women reported they felt uncomfortable and sometimes unsafe when staying at the existing facilities. One aspect that is so special about the shelter is how it was built. It was initiated as a life skills project by Greater Victoria Women's Shelter Society for underemployed women. The project, initiated in 1994, provided the opportunity to give participants hands-on training, working alongside professional tradespeople to learn skill. And some of the features of Sandy Merriman when it started are still in existence. The provision of services to people under the influence of drugs and alcohol, a small home-like facility, inclusion of non-shelter services through the drop-in program, a high level of responsiveness to client feedback. We still serve people over the age of 19 managing difficult challenges such as mental health, addiction issues, poverty, homelessness, hunger, sex work, abuse, or isolation. People who cannot often access transition houses and feel uncomfortable or unsafe staying at the other predominantly male shelters in town. Not only do these act as cough and spit particle guards, it's actually some of the most privacy people have had.
Do you expect them to stay up even after the pandemic's over?
I think it's something to consider. We have clear sight lines. We can do safety check, wellness checks in the rooms without disturbing people. And it gives a sense of privacy at the same time. I think it's definitely something we should consider.
I came here actually because I suffer from depression and wasn't something my family was able to handle, so try to work through that. I am glad I ended up here. I must tell you that I had not been in a shelter before, and I was very uncomfortable with what I was afraid I was getting into. When I got here, basically it changed my mind about shelters almost immediately. Staff has been absolutely great here. They will help you 24/7. If you need to talk in the middle of the night, they're here. If you need them to help you with something during the day, they're here then. It's wonderful, and it's more or less like a little bit of a family. You know, you have your sisters, and we may not all be perfectly great together all the time, so it's just like any other home. It's a well-rounded place, and it helps a lot of women in a lot of different situations. I couldn't have asked for a better place. This has got a lot of room in it. It's got a lot of things to do, everything from art to being outside, gardening to doing stuff inside. A lot of the art that you see around is stuff that people here have done. If you want to spend a night doing puzzles or a week, here's a table for crafts, doing all kinds of things. So really I don't think you could ask for anything better. It's clean, and we all have our chores, so it's part of all of our duty to keep it that way. Meals are great, and we get a lot of donations. I would have a hard time finding something wrong or bad to say about this place. It's quite the opposite, and it's quite the opposite for a lot of people that I've watched come into here. We've talked about it many times just on our own, and how appreciative we are of having a place like this. It's been great.